Welcome to Straight Talk with myObMD podcast. Join me for a bi-weekly discussion on topics most relevant to women's health today. We are your source for medically accurate, real-world advice and all things related to your health and well-being as a woman. From menses to menopause, we've got you covered. I'm your host, Dr. Dana Smith, a fully practicing, board-certified OBGYN physician with close to 20 years experience. I am also the founder of the website that is 100% dedicated to women's health, myobmd.org. At myobmd.org, we write in all aspects related to women's health. Listen to our podcast, visit our website, subscribe to our newsletter, and follow us on Facebook and Instagram, myobmd.org. Hello. Welcome to Straight Talk with myObMD. I'm your host, Dr. Dana Smith. Today, we're going to be talking about a subject that is near and dear to my heart, endometriosis. The reason this subject is near and dear to my heart is because I see so many patients who has this condition who are suffering in pain and just remain suffering in pain for so long, not knowing they have a condition that is treatable. So sometimes these patients, they seek care and they're told, hey, this is normal. This is a normal part of your period. Periods are supposed to be painful. Periods are supposed to be heavy. And some choose not to seek care and simply accept that thought process that, hey, this is normal. So I just want to reiterate that when your periods are to the point where they're interfering with your quality of life, that's not normal, and you should always seek medical counseling and medical evaluation to make sure there's nothing more serious going on. So, getting back to endometriosis, what exactly is it? Today, we're going to be talking about a few things. We're going to be talking about what is endometriosis, what causes it, what are the symptoms of endometriosis, how is it diagnosed, what are your treatment options? So stay tuned for all of this. We'll be talking about endometriosis. So let's first start talking about endometriosis. It really is more than a painful period. What is it? So endometriosis means that there are cells, tissue that line the body of our uterus. So for instance, if you think about your uterus is like a balloon. The inside of the balloon has certain cells. Every month you get your period, these cells shed. With endometriosis, those cells that line the uterus, for some reason, they're outside of the uterus. And of course, they don't belong there. So in most cases, they are in the pelvis. In some cases, they're also in your abdomen, on your bowels. In less common cases, they're in your belly button area, your bladder, your lungs. So what happens is that when you have a period and those cells that are outside, for instance, let's say they're outside of the pelvis, they're on your bowels, and you have a period, those same cells that are on the bowels, they're going to contract and react to the hormones of your period, just like the ones that are inside your uterus. And that causes pain. It causes an immense amount of pain in areas you wouldn't normally expect to have pain during your period. And so it becomes a very serious diagnosis because it starts to affect different organ systems. So what causes it? So there are still theories as to what causes endometriosis. We really don't know for sure, but we have pretty sound theories. The most common of which is something called retrograde menstruation. So when we have our cycle, our periods flow from the uterus through the cervix into the vagina and out onto the sanitary napkin, let's say. Now, on occasion, you can have a flow where there is flow coming down, but there's also flow going back and up. What do I mean by that? So rather than your cycle coming down, you may have a few cells within your cycle that are going through your fallopian tubes, and they're landing through your tube into the pelvis. And they typically land on the backside of the uterus. They can also land on your fallopian tubes as well as your ovaries. And so when this happens, endometriosis develops. You can also have it where the cells are landing on your bowels. And so you have painful bowel movements when this occurs. Now, the retrograde menstruation that I've just described, that's the most common theory as to how endometriosis occurs, but it doesn't explain fully why endometriosis occurs, because we do have cases where you have endometriosis well outside of the pelvis. So you have cases where endometriosis can even be in your lung, let's say. And how does it get there? So there's another theory that the cells of the lining of the uterus, they can spread through your blood or they can spread through your lymphatic system, and they end up in distant places within your body well outside of the pelvis, hence the lung theory. So it's possible that the cells from the lining of the uterus can spread. Okay. Now, that happens less commonly, but we know that it does occur. There's a third theory, and that is the theory that says that the cells that are distant away from the pelvis, that they simply transform into endometrial cells. And so rather than the cells from the uterus traveling through the blood and the lymphatic system, the cells that are already distant undergo a transformational process and they become similar to endometrial cells, so that when you have your cycles every month, these cells are now responding to the hormones, just like the cells within the uterus. Now, of course, other cause of endometriosis is genetic. There is always a genetic component because it tends to occur more commonly in families. And so having a family member who has endometriosis will increase your risk of developing endometriosis. And so those are the more common theories as to how endometriosis develops. Now, how do you know if you have endometriosis? What are the symptoms? So the symptoms can sometimes be vague, and few patients will have no symptoms at all. So the vague symptoms, the more subtle symptoms, painful period, right? And so a lot of people, a lot of ladies have painful periods. So this may not really send off any alarms when you tell your doctor, hey, my periods are painful. So how do we distinguish the pain from endometriosis different from the pain of just a regular period? So with a regular period, the pain tends to respond to medicines such as the NSAIDs, so the ibuprofen tablets, things of that nature. They tend to respond. And it's usually very transient. So they last just a few days. You will hear most patients say, hey, my periods, they're pretty bad for the first 1 or 2 days, no more so than the first 3 days, and then it's fine. If you find that your cycles are just very painful, it's not responding to any of the treatment that you're using, and it's lasting a lot longer than, let's say, everybody else that you know, that's a concern. If also you find that you are frequently having to change plans around your period because you just cannot function during your painful period, then that's also a cause for concern. Your cycles should not interfere with your quality of life. So you should still be able to function. You should still be able to work. You should still be able to engage socially while you are on your cycle. If you find that you are not allowing yourself to engage socially, you are not able to do the tasks that are expected of you during your cycles, then that's a problem. And then that's something that you should seek medical attention for, because that is not normal. So, the symptoms of endometriosis: pain, pain, and pain. So, ladies with endometriosis, they have pain with their menses, they have pain with intercourse, they have pain with bowel movements, they have pain for no reason at all. The pain can get so bad that you may start to feel nauseated, weak. You may lose your interest in routine activities. Few women are asymptomatic, meaning that they have no symptoms. Infertility, the difficulty in becoming pregnant, is very common with endometriosis. So, if you feel you have this condition, then that's something, again, you should seek medical evaluation for. How is it diagnosed? The only true way to know for sure if you have endometriosis is to have surgery, because it's visible on surgery. And sometimes you can also do a biopsy to confirm the diagnosis through surgery. However, we do not operate on everyone with a painful period. If you go to your doctor and you say, I'm having these painful periods, I can't work, I can't cook, I can't do anything, I can't go out to dinner, it's so bad, it's interfering with my love life because I'm not intimate, because I'm fearful of the pain, then your doctor will have the suspicion that, hey, this may be endometriosis. Now, we have that suspicion, but that doesn't mean that surgery will be offered. What's offered is treatment. Once treatment is offered and you start treatment, if you respond to the treatment, meaning that you get better, then that is enough to presume a diagnosis of endometriosis. So, just to avoid operating on everyone with painful periods, first, if we suspect that you have this condition, then we'll offer treatment. The treatment is simple enough to take. And if you respond to treatment, then we presume you have a diagnosis of endometriosis. For some patients, they may not respond to treatment. They may take the medicines and not get better. And so for those patients, they may need surgery to make sure, one, it's not something else that is even more serious, and to confirm that it is indeed endometriosis, simply because if you're not responding to the simple drugs, the simple medication, and the simple treatment regimen, you'll need something stronger. And in order to justify putting your body through stronger medicines, we will need to have the diagnosis confirmed. And so, for those of you who are not getting better with just a simple treatment, then surgery may be an option. So, that is how it is diagnosed. Now, what are your treatment options? Treatment options for endometriosis. So, most of the treatment options are through medication. And I know there are a lot of things for which patients are seeking holistic therapy for. There are not a whole lot of holistic options that I am aware of that may be used to treat endometriosis. If there are, I'm happy to hear from you about them. Typically, the treatment involves either hormonal medications or non-hormonal medications. So, the non-hormonal medications includes NSAIDs. So NSAIDs are a very common type of pain reliever that are sold over the counter, the generic name of which is ibuprofen. Those medicines are used to treat the pain associated with endometriosis. It will not get rid of endometriosis. It will simply help to reduce the pain. Here is the caveat. If you find that you're needing to be taking ibuprofen in high doses for a very long time, that is not good, because that can and will affect your kidney functions. And so if you find that you're needing to take high doses of ibuprofen to function and it's going on for a very long time, for days or weeks, then you need to seek medical attention because you'll need some alternative treatment so that your kidneys can remain healthy. Because if you continue to take ibuprofen for prolonged periods, that will not only damage your kidney, but also can damage the lining of your stomach. And so it's important to make sure that your treatments can be combined. You can have a combination of treatments so that you're not doing any one thing in excess. So that is the non-hormonal medicine. Hormones that are used are progesterone. Progesterones are very good at treating endometriosis, not just the pain of endometriosis, but they actually make the endometriosis less active. And so you can take that in the form of a pill. You can also get that in the form of IUDs, some intrauterine devices. They release progesterone, such as the Skyla or the Mirena. You can also get progesterone through injectables like the Depo-Provera injection. And you can get progesterone through an implant that's implanted in your arm called a Nexplanon. And so these are all different regimens that can be used to treat endometriosis. Now, all of these are hormone. Most of them are contraceptive. Not all, but most of them are contraceptive. And so if you are trying to become pregnant, then those options are just not good options for you because they will prevent you from becoming pregnant. So the non-contraceptive hormonal regimens, you can do what's called a cyclical progesterone. And that just means that you're still taking progesterone, you're taking it by mouth, you're taking a pill form, and you take it usually 10 days out of each month around the time of your period. And that's just to make you less active, that make the endometriosis less active rather. And so help to reduce your symptoms. There is another hormone called Lupron, the generic name of which is Luprolide, and that's an injectable that is given. And that is one of the more stronger medicines to use. And so most patients who are going to be taking Lupron would have had a confirmed diagnosis. They would have had either surgery or some other form of confirmation that the condition is indeed endometriosis. And so in that case, the Lupron may be offered. Lupron is very effective. It's very effective in reducing the symptoms of endometriosis. The problem with it is it's temporary. It does not last. However, even though it doesn't last, because the pain of endometriosis is so bad, it may still be helpful for you to use it because it will at least give you a reprieve of a few months. And so you can take Lupron in several ways. You can do it monthly for 3 months. The dose of 3 months can be given one time, or you can divide them out over 3 months. The other issue with Lupron is that some ladies, they feel like they're getting menopausal symptoms on Lupron. And so you may have hot flashes. So that's just something to be aware of. But it is a very effective treatment for the treatment of endometriosis. And it's not uncommonly used because it's so effective. But again, we know that it's temporary. Now, there's another hormone called danazol. Frankly, I have never used this because it's a male hormone and it makes the endometriosis inactive. It suppresses your periods, but it has side effects. It has some serious side effects that you have to be aware of and you have to be monitored for. You would have to be monitored. Your liver functions would need to be monitored. Your kidney functions would need to be monitored. You absolutely cannot become pregnant. You can become pregnant, but you should not become pregnant on danazol. but it's not a contraception. So it's definitely not the first thing that we reach for the treatment of endometriosis, but it is a treatment option. So those are the main ways of treating endometriosis medically. Now, the non-medical ways of treating endometriosis, if you want to just address the pain, you can always try the holistic measures of acupressure and acupuncture. I am not aware of their effectiveness, but if it is effective for you, then hooray for you. That's wonderful. But really, we are not clear on how effective those are, but it would not hurt to try. Now, what are some of the habits that you can do or stop doing to help with endometriosis? So, if you smoke, then you should stop smoking because that will make your endometriosis symptoms worsen. Breastfeeding actually reduces your risk of endometriosis. So, the longer you breastfeed, the lower your risk of endometriosis and its symptoms. And regular exercise. So ladies who exercise for 4 hours or more per week, which I know that's a lot of exercise for me anyway. But if you exercise 4 more hours per week, then your endometriosis symptoms may be reduced. Now let's talk about the patient, the lady who wants to become pregnant that has endometriosis. So, if you know you have endometriosis and you are trying to become pregnant, you will likely need some help. The reason being, it's because what happens with endometriosis is once that tissue that lines the uterus is now outside of the pelvis and it becomes irritated and inflamed on a monthly basis, it starts to create scar tissue. And scar tissue, if you think about scar tissue, it's almost like you ever go into like a haunted house and you see like these webs all over the place and they're attached. Things are just all attached. And so that is kind of scar tissue, but it's more dense. It's definitely not flimsy. And so what happens is that scar tissue, it's a glue. It's like a glue that makes things starts to stick together. And the way that you become pregnant is that when you have intercourse, of course, there's the sperm. The sperm travels through the fallopian tube. It encounters the egg, and then they come back to the uterus. The fertilized egg makes its way back to the uterus. Well, unfortunately, with endometriosis is that there's so much scar tissue, it limits the mobility of your pelvis. So things are just not free flowing like they should. And so the poor sperm has a hard time getting to the uterus, getting to the ovary, to the eggs. And so it makes it more difficult to become pregnant. And so if you would like to become pregnant, then you may need some help from an infertility specialist. You also may need some surgical removal of the scar tissue. Now, that is a double-edged sword because even though there's surgical removal of the scar tissue, the scarring can return. So you do it, but again, we don't expect that treatment to be permanent in nature. It's a temporary fix. But still, of course, it is a treatment option. So, what happens if you have endometriosis and you choose not to get it treated and you don't even have it diagnosed? Our concern is that the endometriosis can cause a few things. They can cause these cysts on the ovaries. They're called endometriomas. And so these cysts on the ovaries, they have a very small potential, but still there, they have a small potential of becoming cancer. And so ladies with endometriosis, we do need to be monitored. And especially if you have any of these cysts, they either need to be removed surgically or monitored by ultrasound to make sure they're not growing fast. If they are, then they would have to be removed. Now, most patients with endometriosis, if surgery is an option, us as a general gynecologist will perform your surgery. However, there are some cases that their pelvis is so excessively scarred that we actually refer those patients to a GYN oncologist. We refer those patients to a GYN oncologist not because we feel you have cancer, but because the surgical skills that are needed are sometimes beyond the scope of the general gynecologist. And the GYN oncologist is just more skilled at dealing with excessive scarring. And so sometimes your doctor may refer you to a GYN oncologist for surgical treatment. Don't be scared by that. It's okay. So just to be aware, endometriosis, it's a treatable condition, very painful condition. If you feel you have it, make sure you get yourself evaluated so you can see what all your treatment options are. Make sure you know that you're not alone, and this is something that can and should be treated. Thank you for tuning in to another podcast of Straight Talk with myObMD. I'm your host, Dr. Dana Smith. Until we meet again. Thank you for listening to another episode of Straight Talk with myObMD podcast. To learn more about this topic, visit our website at myobmd.org. Subscribe to our newsletter, follow us on Facebook and Instagram. I can't wait to spend more time with you on our next episode of Straight Talk with myObMD.